Good afternoon. Over this past weekend, we marked the 20th anniversary of September 11th, 2001. That day was one of terror, of death. I lost a classmate of mine from college. It remains the worst terror attack on U.S. soil in our nation's history. But it was also a day of heroism, of patriotism, where so many people put their country and their neighbors ahead of their own lives, making sacrifices most of us cannot imagine. The passengers of Flight 93 gave their lives protecting this country and its people. They weren't soldiers, just everyday Americans who believed that we all have a duty to the safety of this nation and of our people. The first responders at the Trade Center and the Pentagon, they did the same, running into a collapsing building, hoping that they could pull one or two people out. For the past 20 years, we have rightfully held up these efforts, these sacrifices, as being the very best of us, the height of patriotism, of goodness, the definition of what makes a hero. Today, we're not called upon to storm a beach like our grandparents. We're not called upon to stop a group of terrorists from taking over an airplane. We're not called upon to run into a collapsing skyscraper. But we are called upon, just like those heroes, to protect one another. The sacrifices we're asked to make, getting vaccinated, wearing a mask, are not that great compared to what we hold up as the very best of us. If first responders in 9/11 can charge into a collapsing building trying to save a few people, anyone they can find, surely we can do this to save tens of millions of people around this globe. In Kentucky, we've already lost over 8,000 of our family members, our friends, our neighbors. COVID is our enemy. So let's channel our patriotism, our heroism, our unity, our faith, our values, our humanity, and defeat it. The example's out there, and it doesn't take that much sacrifice from each of us. We can do this, and we have to. We have to because right now COVID is as bad in Kentucky as it has ever been in this pandemic, and right now, sadly, we are one of the hottest states in the country, where virtually every single one of our counties isn't just red, meaning a high incident rate. It's some of the fastest spreading counties in the country. We hold far too many of the top 10 counties in terms of incident rate. And the redder that map, that means the more sickness there is, the more illness there is, the more people who need to be in the hospital, who need an ICU bed, that are going to need a machine just to breathe. That's what a ventilator is. Don't let it desensitize you. It means you can't breathe, or your loved one can't breathe on their own anymore. And the redder that your part of the map is, the more devastation and death that you're going to see. And we're seeing it all over, including in our school systems. Heartbroken to see that Lee County, just one school, now lost its second member. So again, don't fool yourself. I heard a whole lot last year about how COVID doesn't spread in schools. COVID spreads everywhere, anywhere it can. It doesn't have any rules other than it will do what it takes to kill as many of us as it can, which means we have to make good decisions, smart decisions, and not just say, I really want to do something. And so I'm going to find all these reasons why COVID somehow couldn't get into what that thing I want to do is. Let's remember that it's there and we have to act accordingly. And that's why I've called on every Kentuckian. We're at the point where only you can make the difference. I call this breaking the Thanksgiving dinner rule because it's about having tough conversations that we avoid. I've now been asking people to get vaccinated since December the 13th, when I watched those trucks roll out of the manufacturing facilities. I remember that day well. I was on the treadmill watching them come out. It's my mom's birthday. And that was an exciting day. I remember the 15th, watching the first shipment come into U of L Hospital and watching the first person in Kentucky get vaccinated. Anybody who's going to get vaccinated because I asked them to, or even other political leaders, or at this point, even faith leaders and local leaders have gotten vaccinated. And we're going to show you some information we've been able to now get with an update to where we have more people that we can account for where they've been vaccinated. But we're to the point where those that haven't, they need you. They need someone that they know, that they love, and that they care about. And let me start by saying, breaking this Thanksgiving dinner rule doesn't guarantee that they're going to get vaccinated, but it gives them the best shot at a time when they are likely to get sick, to get the Delta variant, to have the worst sickness in their lives, and probably to be at the greatest chance for death. Make this call, please. Sit down and think about who it is that you know, that you care about, that hasn't been vaccinated, and make this call. It's the best shot of them getting protected and us moving past this. Because the unvaccinated right now are the least protected among us. CDC finding that they are 11 times more likely to die of COVID-19 right now. Think that's astounding, right? To say something is 11 times more likely to happen, especially when it's something as serious as death. Again, they're in dispute in the science. This is all fact versus fiction, reality versus misinformation. You are at incredible risk if you don't get vaccinated. Vaccines are safe and effective. They won't make you sterile. They won't cause problems with childbirth. They don't have anywhere near the concerns related to them, even with the worst side effects, as COVID. Bowling Green has been hit hard, but the medical center at Bowling Green has continued to fight for those suffering during this pandemic. Our healthcare heroes are overwhelmed, exhausted, and want to return to their normal lives. And what you'll hear is a way to get that done are two things: getting vaccinated and wearing a mask. Today, we'll hear from two nurses on the Bowling Green Medical Center nursing staff that battle this deadly virus every day. Clinical outcome specialist Alicia Hume and clinical nurse educator Melissa Gilpin will share their experiences via video and discuss why getting vaccinated is so important. This video is taken right outside of their shift at the hospital.
My name is Alicia. I'm an RN here at MedCenter Health in Bowling Green. I work in the emergency department. One thing that we have noticed recently is a big influx of COVID positive patients that are younger patients. The ones that are the sickest are the ones that are unvaccinated. The ones that are vaccinated aren't getting as sick, aren't having to be admitted typically, unless they have some comorbidities, chronic health problems prior to coming in. But we are definitely seeing an uptick in younger people, unvaccinated, that are really sick here in the ER.
My name's Melissa. I'm also a nurse here at MedCenter in the Emergency Department, and I'm the clinical educator for our ER staff. In addition to helping to take care of the patients when we've had such a high influx, Alicia and I also work with our specialty infusion clinic, giving the Regeneron, the monoclonal antibody infusions. We have seen a lot of success with this, and the folks who are able to get in and get the infusions are often feeling better. Unfortunately, we just can't keep up with the demand. We have so many positive patients coming in, and not enough time and not enough space to get everybody this treatment that could be helpful to them. The best thing that we could do is to prevent ever needing it, and the best way to do that is wear your mask and get your vaccine. We are not seeing the vaccinated folks get nearly as sick or needing nearly as much help. We are overwhelmed, our staff are tired, and they are wanting to do the best they can for this community. So get your vaccines, wear your masks, and stay safe.
So that's from Bowling Green, where their patients are younger, they are sicker, and they have so many people testing positive and coming in. They don't have enough time and people to give them the treatment that they need. Think about that. That means if you're not careful, if you are unvaccinated and you get COVID, the resources right now are so taxed that you may be counting on monoclonal antibodies, and we're doing everything we can, and Dr. Stack will talk about them today, to increase it. But this isn't a crutch. I mean, the goal here is not to get COVID, not to hope that a very significant treatment might get you through COVID. Listen, it's a whole lot better to get a shot that's a vaccine than an infusion of antibodies. One teaches your body how to fight the virus. One just helps you, hopefully, to survive it. Our cases continue to be significant, as do our deaths. On Saturday, 4,470 new cases, 18 new deaths. On Sunday, 3,111 new cases, 21 new deaths. Today, Monday, 2,426 new cases, 29 new deaths. In every single one of these days, the largest group by incident rate, what group has the most people testing positive? 10 to 19 years old. That has been the same in every report I have gotten for weeks. School-age kids, by incident rate, testing positive more than anyone else. Next group, 20 to 49-year-olds, every single day. And I think that's especially the 20 to 29-year-olds. As we look at our week-over-week growth, I'm going to point out both in cases and in positivity rate, the Labor Day weekend, and the fact that we did not have nearly the number of people get tested for COVID last week than in the previous weeks, has skewed this data at least a little bit. As you can see, we had fewer reported cases at 27,301 last week than the week before. Folks, we don't think that is real. There's an opposite effect on positivity that we'll show you in a minute. Significantly fewer people getting tested, which means you find out about fewer cases. We believe, but this next week will tell us, that if we'd had the same amount of people tested last week or the week before, we would probably have more cases than our highest week ever, which was over 30,000, though by not as great of an increase as we saw if you move back 3 or 4 weeks ago. So know that fewer people getting tested gives us a less accurate picture of how much virus there is. This week will show us, this coming week, if that is true. So you can see it when we break down the graph of the recent growth too. That again, we think that this is artificial, though we certainly hope that the rate of increase in cases is slowing, though we again have seen positivity rate pick up at different times. So let's look at the positivity rate. Okay, so fewer tests, which is what we had last week, will get you fewer positive results, right? There's just not as much opportunity there, but it can also increase your positivity rate. If you don't have enough tests out there, even if you have a lot of virus, it can inflate the positivity rate more than it is. Early on in the pandemic, if you look to the far left, we'd have really high positivity rates because we didn't have that many tests. And we were telling people don't go in to get tested unless you're really sick because we didn't have enough tests. But when you have a weekend like last weekend where fewer people are getting tested on a holiday weekend, more people that are sick are getting tested, and you're getting a less accurate picture. So we believe this next week's going to be important to see our trend, and that the lower number of tests during this Labor Day week, if we could call it, which was last week, has actually given us a slightly skewed picture, we believe, of the trends, but in different ways on cases and positivity. But that's how it works. It makes sense that both would move in different directions. We believe our positivity rate right now isn't at 14%. It's somewhere in the 13s, which is still way too high, but you need enough tests to get a good rate. And so if you'll look at the next one, you'll see that we think that's probably more level as opposed to an increase if we had some more tests. Hospitals continue to be hit extremely hard. As of today, 69% of Kentucky's hospitals, which means 66 of 96 of them, are reporting critical staffing shortages. This is our highest number to date, meaning our hospitals are struggling more today than at any other point in the pandemic, at least looking at how many of them are struggling. They are working hard to increase the number of ICU beds that are out there. They are stopping elective surgeries. They are taking ORs and turning them into ICU beds. And so many of them are struggling. St. Joe, London reported holding many patients in the emergency departments for beds or transfers. They had 63 COVID-19 inpatients on Saturday. They had 13 on ventilators. 13. That is not normal for that hospital. To give you another example of how it feels, the team at Pikeville Medical Center has been hit hard but continues to fight for Kentuckians. The virus is deadly. Again, these are brave healthcare heroes that continue to work to protect us. But that doesn't mean it's not frustrating and difficult and tired and traumatic on them. These are folks that aren't supposed to have to watch people die every day, especially ones that know in healthcare how preventable it is. I can't imagine how it must feel as you're about to intubate somebody for them to ask for the vaccine. We've talked a lot about how hard that is on the individual being intubated that may not make it. But how many times you can watch that and watch somebody slip away? It's got to take a piece of you each and every time. I think you'll see that from Laura Jeviden, a COVID unit shift supervisor at Pikeville Medical Center. Laura normally works on the cardiothoracic vascular unit, so normally wouldn't be doing anything like this, but was transferred when her unit completely shifted, entire unit, to help COVID-19 patients. She joins us via video to discuss the heartbreak that she encounters on almost a daily basis.
Normally I work on a cardiothoracic vascular unit. About 3 weeks ago, we slowly started taking on COVID patients. Started out with 1, next day we were 3. Within those 3 days, we completely shifted over to COVID. Today, I have 38 COVID patients on my unit. That is every room that we can possibly open, every patient we can possibly take care of. They beg for you to call their families. They beg for you to tell their families that they love them. Once they make it to the ICU to get intubated, they're sedated. So whatever they gotta say before that. Last week, told me, we knew we were going that way. We knew it. He had a BiPAP on, he was maxed out on his oxygen on it. We were dropping. He said, just take it off, let me die. And I begged him, no, not today. Today's not the day. You've got more fight. Today's not the day. We're not going to do it. And so I called his wife. So she talked to him, and he said, okay, I'll do it a little while longer. So his BiPAP was so loud, she couldn't really hear what he was saying. So I said, what do you want me to tell your wife? He could hear her. She talked to him. Before he hung up, he said, tell her that I love her. I'll be on the ventilator by this evening. 2 hours later, unresponsive. Put him on the ventilator. Next day, he was made comfort measures on the ventilator. He passed away. That's my everyday. What is it like on a daily basis? Those are the questions you get asked. Somebody's gasping for air, and you're trying to rush them to the ICU, and we're tanking, and then you're slowing down to answer questions. Should I tell my family, is this the last time that I'm ever going to talk to them, or is it not the last time I'm ever going to talk to them? And so you slow down and you answer those questions. And you can say, let's just tell them you really love them. Tell them how you feel about them. And let's really talk to them, and please FaceTime them and look at them and let them know that eye to eye, okay? Every patient that we have had says that they regret not getting their COVID vaccine. Every single patient says that. Every patient says that they wish not only they had got it, their family had got it, their friends had got it. They wish that they had never listened to anybody who said don't get it. They regret waiting. Our patients are a great advocate at this point. They are telling people, get out, get vaccinated. You don't want this. You don't want to be stuck in the hospital. You know, like I said, they're stuck in a bed, not able to get out of bed because their heart rate's jumped up, because they can't breathe, because they feel so poorly at that point that they can do so little for themselves. Get the vaccine and wear a mask. That's all you can do. It is the best prevention that anybody can have. That's the best treatment for COVID, and the only true cure for COVID is prevention. That's it.
That's my everyday. Did y'all catch that? Every day. We're doing everything we can. And I'm spending a lot of my time trying to provide support to her and to hospitals across Kentucky. Well, I don't have the ability anymore to require masking indoors across Kentucky. That's something I would have now done weeks ago because it's necessary. Look at how red that map was, and it's stopped 3 separate surges. Why in the world would we remove a tool that has successfully stopped more people from dying 3 straight times? Well, I can't do that. I can, and I am doing everything I can to help these healthcare heroes to have the maximum amount of capacity. Big news from last week, and they're going out today, if not tomorrow, is we now have National Guard at 25 different hospitals across Kentucky. I guess about 400 guardsmen and guardswomen. This is, I think, the largest deployment for a healthcare crisis in our Commonwealth's history. Every hospital that they go to talk about how it's not only a morale boost, but it truly helps in the operation, and it allows them to provide more care to more patients. We combine this, and we'll show you locations on Thursday, with testing. We go in and we take over testing from hospitals that are struggling. We free up their clinicians, or we come in the community and provide alternative testing locations that they can push people to go get those tests. We've then launched an army of nursing students all over Kentucky with so many different groups helping out. I think we're going to get to hear from some of them directly, some of these students directly on Thursday, because can you imagine being a nursing student right now and saying, yes, I want to go into that COVID unit. In many ways, that's today's version of running into that building to try to help people, to try to do the very right thing. And they are absolutely heroic for doing it. And we greatly appreciate them. There's the FEMA strike teams, 5 EMS strike teams that have been incredibly helpful, and the 1 medical team that is at St. Clair providing direct services. We're going to continue to look for any other way that we can help. Those certainly include some things we're already doing now, which is working to increase the monoclonal antibody treatments. Dr. Stack's going to talk about that as well, as he's going to break down our school testing program, which has been in place for a while. Vaccines and masks. Obviously, masks, an incredibly important tool to slow the spread. You want to know how there will be a bed available for you if you get COVID or if you're in a car accident, a bed for your loved one, capacity available for the surgery that they need that's being put off. Put on a mask. That's the reason we haven't been in this hospital situation yet in this pandemic. This doesn't defeat COVID alone, but it reduces the number of cases to make sure we have enough hospital personnel and beds to treat everybody who needs it. I mean, pay it forward. for the others, for anybody out there who may be in a car accident. That's the mask. Defeating COVID is about the vaccines. Now, we've been telling you for about 2 weeks that we were going to make an upgrade to the new census data for 2019. We're going to go over all that today. There are about 3 things that are changing, and I want to make sure that we understand all 3 that we're able to include on this. So can we first bring up what is normally page 2 of our vaccine reports? So it's going to get in the weeds if you don't look at our vaccine reports every day. I know that everybody doesn't. But page 1 has the new vaccines for that day. Page 2 has 3 separate things that are changing. Can you go to the next one? Okay. So this is the population that we have been using to date, right? That's not 2019 because the 2019 census just came out. A couple things you'll notice on here. We haven't been able to get a total population 12 years or older and a population of 12 to 17. We now have that information. So you'll see on the, can you go to, oh, this is the new one. So we now can show, and you will see an update as we move to today's of population that is from the 2019 census. We'll show you that in a minute. Next piece, unknown. If you've really looked at these, you've known we've got about 190,000 Kentuckians whose demographics we weren't able to pull based on the 2019 census data. When we did our upgrade, and we'll show you in a minute, we were able to get information on all but about 16,000 of these, which means it's going to significantly impact the percentages of the vaccinated in the different groups when you add 170 something thousand people where they belong. And the last piece, can we move to the next one? Not that one. This is the last piece in that we always had that net additional Kentuckians that got vaccinated out of state. With the data we now have, we can pull all that together. And instead of the number of people vaccinated in Kentucky, we're able to get you the number of Kentuckians that are vaccinated. So 3 things, right? Updating the population numbers based on the 2019 census. And I'll tell you, the 50 to 64 age group, we have fewer people in Kentucky than we did at the previous one. 65 and up, we have more people in Kentucky than we did before. Second piece is we were able to get the vast majority of the unknowns and the data related to them and put them in the demographic age group that they needed to be in. And third, we were able to transition from people vaccinated in Kentucky to Kentuckians. So that is those are the switches that we've made today. So as of today, we can report the unique number of Kentuckians that have gotten at least one shot of hope are 2,618,081. That's 2,618,081. So you will see that has made several major differences here when we look at our demographic data. And I don't have this sheet in front of me. Can you put it back up? Let's look at the age groups that you just had up. So our total number of unique persons vaccinated, total, no, that's not. We didn't get this slide right. Let me go through it as we have it here. So we can now do a total for all Kentuckians, our entire population that has gotten at least their first shot of hope. We can report today that 59% of Kentuckians, that's everybody, even those that are too young, 59% of all Kentuckians have gotten at least one shot of hope. Now let's move to the next age group. That's who is eligible, right? So that is 12 and up. That leaves out those numbers of Kentuckians that are under 12. 69% of Kentuckians 12 or older that are eligible to get a shot of hope have now gotten at least one shot. That is 69% of all Kentuckians 12 and up. Now let's look at adults. So this is a normal thing, and that was, I think, the number that was up there. These are people who can make their own decisions. 18 and up is why we show it. Of adults, 71% of Kentucky adults have now gotten at least one shot. And then we'll break down the age groups. If you want to put that slide back up, I think the age groups are accurate. So I wouldn't look at the total unique persons vaccinated. I think that's meant to be the 18 and up. That's where that line used to be. I'm sorry I didn't catch that before we put it up. That was 70.6 or 7%, rounded to 71. But here are some big changes. 65 and up, 91%. It means a lot of the 190,000 that we weren't able previously to put an age on are in the 65 and up. 50 to 64, we also saw a bump, 78%. 40 to 49, 68%. 30 to 39, 62%. This one was a good surprise. A number of that 190,000 was in this age range as well. 18 to 29, it wasn't much of an increase on what we've seen before. This is the second largest age group by incident rate that we see. In other words, people getting COVID a lot more than other age ranges. 18 to 29, we need a lot better. And this is the first time we've been able to show you the percentage of 12 to 17-year-olds that have gotten at least one shot. That is 45%. Now remember, these are percentages based on the most accurate data because these are the new 2019 census numbers, but they are just one shot. A lot of what you'll hear on the national news is they do a fully vaccinated. But this gives a clear picture. It says at 65 and up, we're doing a much better job, though I will tell you the 9% that haven't gotten any form of vaccination in that age group are the most at risk that are out there. It also shows we got a lot of work to do, especially 12 to 29. That's the age group that we desperately need more people to get vaccinated. That's the age group that is testing positive the most. Remember when I said 12 to, because we do it differently, 12 to 9 or 10 to 19 is the highest incident rate. That shows you it's also the least vaccinated amongst those groups. So moving forward, this is the type of data that we will be able to present based on those three changes, which again are updating our numbers to the 2019 census. Second is we are now able to add in folks that have been vaccinated out of state. And third is finally being able to identify the majority of the 190,000 Kentuckians who we did not have demographic data on before. So we show you the demographic data by age. We also show it to you by county. We have seen, let's do the 40% and up. We have seen not just an influx of additional data on age, but also on location, which again, were part of those 190,000. So counties with more than 40% that have been added, Fulton, but Fulton has also crossed the 50% line. Others, Webster, Breckenridge, Meade, Trimble, Monroe, Lincoln, Gallatin, Whitley, Bell, Harlan, Menifee, Lawrence, and Martin. Good job, but 40% ain't nearly enough. Keep working. We like to see this threshold cross, but every county ought to be 40+%. So keep working. Counties with 50% or more. And after today, we're going to have a 60% slide too, because what the Delta variant showing us is we got to be way above 60. Fulton, Washington, Marion, Taylor, Powell, Wolf, Bath, Pike, Floyd, and Martin, all above 50%. But that blue, again, that every area that's red here, it's more likely than not that anyone you run into is unvaccinated in your county. That is a big concern, and we need to see this map change as quickly as possible. With that, I'm going to turn it over to Dr. Stack, who's going to give kind of an overall overview of where he sees us being, talk about monoclonal antibody treatments and how much they have increased in the Commonwealth, as well as school testing.
Thank you, Governor. Good afternoon, everyone. So I'm going to start, like you said, with three things. We're going to give a general update, talk about monoclonal antibodies, and then talk about K-12 school testing. So as the governor has already described, new cases in the Commonwealth remain at an all-time high. There was a dip last week, but I think that most of that was due to markedly decreased testing on Sunday and Monday associated with the Labor Day week. So what I hope is that maybe there's a slowing of the growth. And this week, if we're very fortunate, maybe we'll see that there's either only a small bump up or perhaps even a relative flattening from the prior week. But I don't see it matching the same lower level that we've had last week, which was suppressed by the holiday weekend. The hospital, actually, first of all, on the younger cases, I just want to emphasize what the governor has shared. The highest incidence rate, meaning the highest rate of disease in any age group, is currently in the 10 to 19-year-old age group. These are our school-age kids. And they have an incidence rate of 121 per 100,000. By comparison, if you're over 80, it's only 38. So there's a more than more than a threefold higher rate of disease in school-age children than there is in the population over 80. And what else is true is that population over 80 has well over 91% vaccine uptake. Whereas the population between 12 to 17 years old, which the governor just showed for the first time, given our transition to the new census data, is only about 45% vaccinated. So at half the vaccination rate, we have threefold higher disease rate in the younger cohort. So folks, never, never, never has it been more important than now to encourage vaccine uptake. We've got more than half of school-age children still eligible to get vaccinated, but not vaccinated. And never has it been more important for us to have children wearing masks whenever they are indoors in the school setting, as well as the adults in the building. So these are some important decisions these local school boards now have to make, and the safety and well-being of the children, the people, the adults in the building, and also their families certainly is in play at the moment. COVID hospitalizations remain at an all-time high. We've seen a little wobbling over the last week or so, sort of among these really high peaks of disease we've had for hospitalizations, ICU use, and ventilator use. Those very high levels are not sustainable. And it really breaks my heart to see these testimonials from these nurses and physicians and other healthcare clinicians. I don't know that the public really fully appreciates just how anguishing that is for those healthcare workers to be in this situation. Though we deal with sick people on a regular basis, we don't have to confront death on a daily, regular basis. And it has got to be in these hospitals like a battle zone or a battlefield right now, with people dying on a daily basis, and the anguish and the torment that goes with that for the person who's confronting their mortality, often now at a younger age, and also with the family members who face the loss of their loved ones. So, folks, as we drive around, and I know you all have the same experience, there's cars all out on the road, there's places of business that are all full, there's entertainment venues that are full. Folks, there is still a really serious pandemic, and though you may not be in a hospital right now, our hospitals are at the brink of collapse in many communities. And it's causing consequences to people, not just with COVID, but also to people without COVID who can't get some of their procedures or hospitalizations taken care of, or have a heart attack or a stroke addressed in a timely manner because there simply are no places for these patients to get their care. The way to get out of this is universal vaccination. That means you all have to make that choice to get vaccinated, and also mask use whenever we're indoors. If we could please put up my slide deck now, I'm going to talk about monoclonals and then testing. So monoclonal antibody administration in Kentucky has expanded dramatically. So in the last 8 weeks, we have gone from about 204 doses of monoclonals given at the beginning of July, all the way up to 3,000 642 doses given. This report comes out every Wednesday from the federal government, so this is through last Wednesday. It'll be updated again this Wednesday for the week that's currently in play. That's an 18-fold increase over just 8 weeks. Monoclonal antibodies are an important tool, but let's remember, these are synthetic, laboratory-created antibodies that give you a temporary, so for less than 90 days, and passive, meaning your body isn't learning how to be more effective. It's a temporary immune boost to help people who are already sick hopefully have a more mild disease. We have another alternative, which would be vaccination, which primes your immune system to create natural antibodies that your own body produces in a natural immune response that then can protect you at least for 8 months or more as the data is still unfolding. So folks, it's a lot easier to get a vaccine than it is to get monoclonals, and it's a lot more complicated to give monoclonals to folks. Even so, we have been working for many weeks to support this increase and support the sites who are doing it. And if we could show the next slide. These are the 139 locations as of last week that were receiving shipments of monoclonal antibodies. Now, we haven't asked all these sites if we can publish their addresses and locations, and they may be clinics or practices that are focusing just on their community or their own practice. In aggregate, though, these 139 sites have administered over 3,600 doses of monoclonal antibodies in the most recent week. We're actively working to create a defined network where we can publish sites that have agreed to allow us to do so, and to then invest in and expand their capacity. So we will keep working to increase this. But again, the cure for the pandemic is vaccination, not monoclonal antibodies. And so I hope that folks will continue to increase their vaccine uptake. If we could show the last slide, please, Kenna. I'm sorry, Jim. This is K through 12 school testing. This is a website for school district superintendents and for school administrators. We stood up using federal funds, a testing program where every single county in the Commonwealth should have access to an approved testing vendor. Federal dollars will be used to pay the vendor directly, but the school leadership has to go to the website, identify a vendor, communicate with the vendor, and create a program that addresses your unique local school and district needs. So there are probably around 2,000 schools in the Commonwealth of Kentucky. There's no way that this is going to work as effectively as having the local school and the local district involved to refine and tailor the program to them. Now we're going to we already have out there guidance, but we're going to put together the guidance we have plus some modified versions of it to give in one packet all the information that schools will need to know for how to do layered mitigation, how to use testing as a tool to help keep people safe from COVID, to keep sick people out of the school setting where they can't infect people, and also to give other guidance for how to determine who should be isolated or quarantined, and information to give them. So that'll all be coming here shortly. We have most of it already created, but we'll put it together in a simpler package. My final thing I would like to say, I think that's my last slide, Jim, is I had to stop out to a couple stores over the weekend, and it's a part of the journey I've had serving with the governor to be recognized. And I just want to thank folks. People have been kind, they've been supportive. Your words of gratitude for the work I've done, the governor's done, but more importantly, the teams that we lead and the many hundreds of people who are supporting you in thousands across the whole state. I want to thank you, and I want to continue to urge us all to be the best versions of ourselves we can possibly be, to be kind to each other, and to remember that there are a lot of people out there hurting right now in those overflowing hospitals, both the healers trying to help them and struggling, and also the people who need their care. So please, let's be kind and considerate to the suffering that's unfolding, even as we are going on with our lives. And the two best things you can do to help keep us all safe, you, your loved ones, and your neighbors, is to wear these masks whenever you're indoors around other people, and to please get vaccinated. Thank you.
You put up that school testing slide. just to clarify on that school testing piece, we received a grant here in Kentucky. It's for about 100 and just the last slide. There we go. We received a grant here in Kentucky. It's about $170 million that's used pretty much exclusively for school testing. 134 million dollars. We did a full RFP process to qualify any and all vendors that could. So this has been available for months now, where any school district can go online and choose any one of the vendors and get testing done at their school for free. Now, we've had some confusion when a school district has gone out, say, to their local health department and said, why won't you do testing for us? There are qualified vendors, but again, you had to go through the RFP process that are out there that any school district can choose from. What we don't have is a program where they can just go out and find anybody and get the testing done. That's competitive bidding, and was used on this, but a program already in place, vendors already in place for absolutely anybody who needs it. All they have to do is go to the website and then make a call. And then I think Steve was charitable when he said that school boards or superintendents had an important decision to make on masking. Let me just say, I don't think that there is a decision. There is one right answer where you choose masking, where you protect your kids, where you keep them in school. And then there is one wrong decision where you endanger children and you allow COVID to spread throughout your community when your hospital is already overburdened. Remember, we take ourselves back, and we always said wearing a mask helps prevent the spread, right? But it doesn't end COVID. I'm sorry, when we said testing doesn't stop COVID, it just lets you know if you have it or not. And oftentimes it doesn't let you know if you have it soon enough. That's why we said at that point, you also need to be wearing a mask so that you won't be spreading it. And when you find out that you have it, you won't have been spreading it that period of time. If schools try to just use a testing program and do not pair it with universal masking, it will not work, and it will endanger the children, it will endanger the teachers, and it will endanger the communities. You simply cannot, in a state, can you show the map from the very beginning, as red as it is, a state that is on fire with COVID and is going to be, at least for a little bit as we come down. You cannot keep your kids in school with that map without universal masking. And if I'm fired up, I'm a parent, and one of my kids isn't old enough to be vaccinated yet. So everybody needs to do the right thing. Everybody who's made a decision thus far, I think, has made the right one that we've heard about. And we're supposed to be responsible for the safety of our children. Let's step up and have the courage to be responsible for them. All right. I'm off my soapbox, and we're on to questions. Chad.
We noticed the hospital regions in northeastern Kentucky, eastern Kentucky, especially where St. Clair and Icahn Medical Center are not in the red. The highest capacity limitations at one point. Are you noticing this trend, and are you targeting the strike teams, or is it too early to see?
It's too early because they are still overwhelmed. And whether that's the tests that have come in recently, whether they're still treating patients that previously tested positive, whether they're coming in from the rest of the region. I hope that what we'll be able to do is to dig out in a place like St. Clair and get it stable, and then move, extra help to other areas. Certainly at some point in a given region, if it's burned hot enough, we ought to see at least a plateau, if not a decrease in cases. But Dr. Stack and I were talking about, at the levels we're at right now, a plateau is no longer something we can live with. Remember when we had plateaus in the past, they were at an area where our hospital capacity was at a point where we could take care of people. That's not where we are. If we have 3 weeks in a row of 30,000 positive cases, we're in deep trouble. Tom.
Thank you, Governor. I have a question for Dr. Stack. Is he available to take?
He is available.
All right.
A question for anybody else is a good thing for me.
Okay. There's a lot of talk lately about a twin-demic. In other words, COVID and the flu this fall. So if you have not been vaccinated against COVID and you would like to, you also want to get vaccinated against the flu. Can you get them at the same time, or should there be a spacing out between the two?
Great. So on your direct question, initially we didn't have enough data, and so they had people space things out. But now you can get more than one vaccination at the same visit. So you can get both the flu shot and the COVID shot at the same visit. That we didn't know that last year, but now there's enough data and we can say that. I want to agree with the governor here. It's difficult. I've said this for 18 months now, trying to calibrate, but the governor said it absolutely correctly. KDPH, Kentucky Department for Public Health guidance, is unequivocal. Indoor masking in the school setting shouldn't be optional now. It is the choice of these schools, but the public health guidance is unwavering and unequivocal. They got to wear masks in schools. Testing does not work without wearing those masks indoors. If you have everyone getting exposed all the time, you can't ever keep up with contact tracing. You can't ever mitigate the spread of disease. So just the governor got it right. If I said it more gently, I could match his intensity for sure. You have to wear these masks when you're in school. That's how kids stay in school.
We flip a coin over who's more fired up on any of these given days. Catherine.
Governor, what's your reaction to the news that the Pfizer vaccine may be available for younger ages soon? And do you think that might have an impact on Kentucky schools?
The question is, what's my reaction to the Pfizer vaccine hopefully being available to younger Kentuckians, I think 5 to 11 soon. Thank God. I have an 11-year-old. And I worry like any other parent worries. And I'm ready. She's ready. She thinks it's unfair that her older brother has gotten vaccinated. We get a lot of that with kids around that age. But I believe in these vaccines. I believe that they make school and everything else so much safer for our kids. I think it will make a big difference because you look at the incident rates and our kids, especially being in school right now with the ability to spread. I'm very excited about it. I'm very excited about it. And personally, as a dad, it can't come fast enough. Drew.
Governor, much like some of the hospitals across the state, some of our corrections facilities like prisons and jails are experiencing shortages due to COVID. Over the weekend, Louisville Metro Corrections had 18 officers on Saturday, 14 on Sunday for 1,600 inmates. They already had staffing shortages for various reasons, but 38 were out because of COVID positive results. Have you had any discussions with local municipalities, whether it's encouraging having a vaccine mandate for corrections officers or providing some kind of assistance from the state?
Sure. Certainly our corrections officers on the state level, and I can't speak to those on the jail level, are some of the lowest vaccinated populations by percentage. And I wish that that wasn't the case. When it could either be with what the president's talking about or others, I think we have misnamed what we call vaccine mandates, because there is not a mandate that anybody that either the president's talked about or others actually get a vaccine, with a few exceptions. It's that they agree to test once a week or get a vaccine and not have to test once a week. So again, you're not required to get the vaccine, but if you don't, you're required to test once a week. That really is a testing requirement. And I think it should have been named that way, but it wasn't. We have that testing requirement for our corrections officers. Those that don't want to get vaccinated have to be tested once a week to try to protect our prisons. And it's gone generally well, though I do think we have had one recent outbreak in one of our facilities. If I could figure out the best way to convince those officers, I would, because I care about them and they are exposed to so many people. You look at our prisoners and we're 85, 88, 90% vaccinated there, but we need to get more of those corrections officers vaccinated. Now, the challenge here is if it wasn't a testing requirement, which we've been able to get by on, But if it was actually purely you must get the vaccine, we might not have enough corrections officers to operate safely. And so it's a real challenge. Now, from a workforce perspective, what you're talking about is exactly why employers overall are mandating vaccines in many places without a testing requirement, or some are doing the other, because how do you keep your productivity if you're manufacturing something, and how do you keep it from spreading all throughout your floor? If you're an airline, how do you keep it from taking out an entire group of pilots and those working within the plane? If you're the NFL, how do you keep it from taking out an entire team and you losing an entire game? Again, I think there is a significant economic interest with getting everybody vaccinated. Karen Czar.
Good afternoon, Governor. Thank you. And hello, Virginia. Governor, this is for you and/or Dr. Stack. A doctor I interviewed at UK talked about comorbidities and said, while there's still an issue, not necessarily as much as we saw in previous surges, and that he's still seeing a disconnect with several people of thinking that it would have to be an extreme comorbidity. And he said a lot of patients look like average Kentuckians.
Yeah.
Can you comment to that?
Yeah, the Delta variant is killing people with no comorbidities at a higher rate than any strain that we have seen thus far. It is getting people sicker, and you can lose your life to the Delta variant even if you have no other health conditions. It is that serious. It's so serious that it has impacted some vaccinated individuals that do have some of those comorbidities. Those are folks that can qualify for the booster shot right now, and we believe that booster is going to significantly help the immunocompromised and really cut down on the breakthrough cases that are having difficult outcomes. But oh no, listen, if you're unvaccinated, there's no free lunch. There's no way to argue yourself around it. If you get this thing, and you are very likely to be the sickest that you will ever be in your lifetime. And remember, we already take a vaccine for every other 1 in 100-year pandemic that we've experienced. By the time you were in 6th grade, and this is to anybody who's unvaccinated out there, by the time you were in 6th grade, you were required to have had 12 vaccines. That includes polio, that includes smallpox, it includes a lot of the things that aren't as dangerous or nearly as dangerous as COVID-19. You got 30 plus shots. You might not remember it, but you lived through every darn one of them. So again, this has never been what it is right now. You know, we all took them before we went to school. They were even passed into law in Kentucky. So we really need people to step up and get that shot. Again, if you know somebody who's unvaccinated, have that tough conversation with them, because they are at real serious risk. Corinne Boyer, WEKU.
Hi, Governor. Dr. Stack mentioned that some hospitals are on the brink of collapse in many communities. And I mean, if that happens, what should the public in those communities expect? And is there any more detail available on that?
What it means is that if you are injured, you're going to have a hard time finding an ER that can take you. If you have a heart attack, you might be waiting in the ambulance for hours at the hospital because they can't find somebody else to help you while that EMT is trying to keep you alive. It means that if you have a condition where you needed a surgery for a long time, you can't get in to get it because they're treating COVID patients. It means that the normal screenings that you need to do, some places might not be able to do them. Hospitals that are on the brink of collapse that end up full result in death, and more death than we should have. More death from people who will have COVID that might have made it, but more death from people that are hurting from something other than COVID. And hospitals on the brink of collapse are also going to have more burnout, which means more of these healthcare heroes, understandably, are going to walk away, which creates that spiral, which means there are fewer and fewer and fewer people to help. But the answer is death. That's what happens when a hospital is overrun. It's what we saw in El Paso earlier in the pandemic. It's what we saw in many ways early on in New York. Can't let ourselves get there. I was so proud during this pandemic that we'd never been at this point. Yet here we are, given that we don't have the same tools we did before, that we can't require masking. But you know what? We can keep ourselves from going any further. Rylan Barton, Kentucky Public Radio.
Hi, Governor. Do you think anything the legislature passed during the special session fell outside your official call for the session, especially dissolving the school mask mandate? And do you plan on challenging anything that passed?
You know, I think it would ultimately fall to a court to decide if something was in or outside the call. I haven't looked at any of that law right now. I don't see a challenge coming from my office. I certainly hope and pray that every school district makes the only decision that protects children and doesn't try to convince themselves that somehow you can protect children by letting a one every 100-year pandemic run through your school, poorly ventilated building with unvaccinated kids. Alex Akisto from the Herald Leader.
Hey, Governor,
I'm holding back.
you said, and because of the bills that the General Assembly passed, that you no longer have the ability to enforce a statewide mask mandate. So you're sort of switching your focus to trying to expand hospital capacity. You've already done a number of things to try to do that. What do you expect will be your next federal aid request, either from the national stockpile or for supplemental staffing? Thanks.
Well, certainly supplemental staffing remains on the table. We have at least one other hospital that was very, very close at a different time during this pandemic. We think we would have had what we call the medical strike team down at it. Hurricane Ida changed a lot on availability, but we will continue to look towards FEMA to provide whatever aid they can. And as some of the other areas lessen a little bit, we're going to hope to get more resources. Right now, we don't have requests out to the federal stockpile. We are working with our providers on going through some new processes that HHS has in ordering the monoclonal antibodies. What they're trying to make sure is those that are ordering them are also using them. And they're trying to pair that up to where they've got to have reports of the treatments going into people to send them to you, so that we don't have some areas that aren't hit like Kentucky stockpiling them while we might not be getting enough. We're always looking for that next good idea on how to increase hospital capacity. Certainly a group like Primary Care Center in Hazard has been able to open up its facility that normally wouldn't treat people nearly as sick as those that it is right now, but ARH Hazard doesn't have the room. And so we're seeing that the community health, federally qualified community health centers doing the same. Some of those, like in Lexington, the health department, I think, is going to work to take over some of the monoclonal antibody treatments. So it's moving out in the community and seeing what additional partnerships we can have to increase that capacity. Certainly, we want to continue to work with businesses that are going to push vaccinations, and I think, as Al mentioned last week, masking. Any partnership we can get that encourages it, but we also need people out there to do better. I think a lot of us are frustrated, and don't want to have to wear a mask in a lot of places anymore. We've gotten vaccinated. We've gotten everybody in our family vaccinated. We've done it right. We've worked to protect people for a long time, but we still need you. I got to experience 2 church services this weekend. Mine virtually, and then got to go to an amazing groundbreaking in Lexington for a new building at the African American Catholic Church there in Lexington, and listening to the message. We're not supposed to get tired. We're supposed to continue doing the right things even when it's hard. Samantha Johnson, 14 News, WFIE, Evansville.
Good afternoon, Governor. Can you hear me okay?
I can hear you.
Perfect. Perfect. Thank you. So just one quick question for you. When it comes to vaccinations over the past couple of weeks, you've talked a lot about personal responsibility. And even like you mentioned earlier today, you've now been asking Kentuckians to get vaccinated for exactly 9 months. So what more can you say, or maybe what more can I say as a journalist to encourage the remaining 31% of eligible Kentuckians to get vaccinated?
Well, I think it's telling very personal stories. It's telling stories of those that waited too long, not because it scares other people, though it should, but because the message at that point from that individual is so real and so personal that maybe it will reach somebody that otherwise hadn't wanted to hear. I also think it's very important to lift up stories of those that have been vaccinated and want to get a loved one vaccinated, but haven't been able to convince them or put it in the right words, because maybe that reaches somebody else and they realize the impact that their decision or failure to make the decision has on other people. I mean, if you're unvaccinated, we're worried about you. We're not trying to impose something on you. We're not trying to, be a big government and pushing something on you. We're worried about you. We just want you to live. And it may sound trite to say we're trying to save your life. We're trying to get you to save your life, and we're trying to get you to make that call that makes it safe to be around you too. Worried that we could hurt you. Nobody's doing it to be mean. They're doing it out of love. And that's what we're trying to convey. Not always well, not always in maybe the patient and loving manner that we need to. But if you're unvaccinated, the reason we're pushing so hard is we care about you. Melissa Patrick, Kentucky Health News.
Hi, Governor. I am thinking last week someone asked if you supported President Biden's new proposals around the COVID response. I was wondering if you've had time to review those and if you support these next actions that he's proposing or not.
So there's still a lot of details that all of us are waiting to hear, but a couple of points that I'll make. First is, I think calling what he's doing, and I think they called it too, a vaccine mandate isn't accurate. It is for any business over 100 people, a requirement that if you're not vaccinated, you get tested once a week. You can choose not to get vaccinated. You can refuse, if that's the word, to get vaccinated, and you can keep your job. You just have to get tested. And in many ways, that's a scientific approach. If you're unvaccinated, you're more likely to get COVID and spread COVID. And your employer has I think a rightful desire to keep you safe, but also if you've chosen not to get vaccinated, not to infect the rest of the workforce. And so I think the controversy that comes around it is more of the name than what's being asked. I think even a number of governors that have come out against it have different groups, at least in state government, that they require to get tested once a week if they're not vaccinated. And certainly the business community, in many ways, like some of the education community, when I'd go ahead and make the requirement that we wear masks in schools, looking for a little cover to do the right thing. I don't want to be critical of what the president's doing, because at least he's trying, right? At least he's trying to do something. He's taking action, and he's willing to take criticism that comes along with it because he wants to beat the darn virus. And he doesn't want us to be here in another year, and he doesn't want to see more people die. And I know he's getting pushed back just like I do, but there are a whole lot of people sitting on the sidelines throwing up their hands saying, well, I asked people to get vaccinated and there's not much more I can do. I think we at least ought to give the president some kudos for actually taking action. Like him or dislike him, he's trying to attack this virus and he's trying to help us win. So I think we ought to dissect all the different pieces in it. And And I think that, again, it shouldn't be red or blue. Your reaction to it shouldn't be what party you're in, though I know that's the first reaction anybody has. And that's one of the reasons that we are where we are in all of this. How about we look at it and see if it'll work? How about we look at it and see if we think it'll get more us out of this faster? Why don't we look at it and say, will it save more lives? Why don't we look at it and say, will people push back harder or will they not? That's a fair discussion. But the whole red or blue thing, if we continue to do that, we're going to continue to fight this thing longer than we have to, because we'll be fighting each other instead of the virus. And more people are going to die. Winning your political argument isn't worth more people dying. All right, I'm going to step back off the soapbox. Morgan Watkins.
Hi, Governor. My question is, are you legally able to either mandate vaccines, like an actual mandate, or to require either vaccinations or regular testing for state government workers across the board? And if you are able to do that, is that something that you're willing to or considering doing?
Well, certainly I think we have the ability as an employer to require testing and to require different levels of testing depending on someone's vaccination status. That's just the science. You're less likely to have it if you're vaccinated than if you're not. That would just be a monitoring program throughout state government. Certainly we have some areas of state government that we are already doing that in, and those are areas where we're trying to protect people. Those are our veterans' homes. Those are our prisons. Those are places that are congregate care settings. We've taken an initial look at what it would take to test state employees at a larger level. We're obviously a very big employer. And then we're continuing to push in every way we can through leadership. And that's got to come all the way down through state government to the commissioner and to every single level about talking to people and truly encouraging them to get vaccinated. I will say the new numbers that have come out, state government is a lot bigger than Franklin County. But if you look at today's vaccine report, you will see in the top 5 counties, some that were used to be in there, Woodford and Franklin, now tied at 75% apiece. Fayette County up to 72, Boone at 67, and making its first entry in a while, Jefferson County, rounding out the top 5 counties vaccinated at 66%. So I think we've done a good job, at least close by Frankfort, in getting our employees vaccinated, but certainly have other areas we need to. One other piece that we have to look at is we have different training programs for folks. And if we have COVID disrupting those training programs, I mean, it could end a whole class of sheriff deputies that we're trying to train, and we thus get 0 out of it. Then we've got to look there at whether or not we've got to require significant amounts of testing or even everybody get vaccinated, because how much can we flush down the toilet in money that we put into those? And also, how many classes can we have where we're not putting the law enforcement or others out on the street that are needed? All right. I know we've gone a little long today, but folks, take care of each other. You know, I admit that last couple times you've seen me, I've been frustrated. Feel like I've been surrounded both personally, losing 2 aunts and what we're going through with a lot of sickness and even some death. But we all have to have a second wind. We all have to be the best versions of ourselves. We've all got to push through. So I'm asking you to please have that difficult conversation and talk to that person that you love and care about. Thanks.